The future of Medicare is important to the country, not just for those of us seniors today, but for future generations. And we lead the way in Medicare in driving delivery system reforms, in ways that reduce waste and improve quality and save money for us all. But the urgent question, I think, when we talk about what Ryan and his gang are trying to do, basically what they are doing, in my opinion, is limiting people's choice of doctors and shifting the costs in the future to middle and lower income Americans in order to pay for a tax break for those of us who enjoy good salaries. How would you explain, Ms. Davis, Ms. Stein, in that order, how does the Romney-Ryan plan limit the people's choice of physicians?
The Ryan premium support would base the premium, this is the most recent version, on the second cheapest plan. It would require it to have the same actuarial value as Medicare benefits, but they could opt to include fitness services, say, and not cover home health. But how would they get the premium down to that level? That's by limiting the doctors that are in their network. So if you need an oncologist, you wouldn't be guaranteed that provider was in the plan. So I think you're exactly right that by basing the voucher on the second cheapest plan available, it would lead to inadequate networks and limited choice for beneficiaries.
Ms. Stein?
Not only do I echo what Ms. Davis said, but also we need to look at what we actually know, because this is not something new. The current private plans and the private plans in the past have all had this impact, and that is that the widest network is traditional Medicare. As soon as you enter into a private plan, and this will be the case with Mr. Ryan's plan, you will have a limited network with limited options for choice of doctors. And in fact, that's the choice that people want, and that would be limited under the Ryan plan.
Can you add on a little bit as to how costs will keep going up, not just for individuals, but for the entire healthcare system in this country as well?
I think that's one of the real shames of what Mr. Ryan is proposing. We have traditional Medicare, which if we encourage to be the option for most of those with Medicare, currently almost 50 million people, has the best bargaining power of any other health system in the country. It's the only semi-health system in the country. And so it can bring down costs if allowed to. So for instance, I think we should be requiring negotiation with prescription drugs under Part D. When you fragment Medicare, as we have been doing since the 1990s, you reduce the risk, not only the risk pool, but the buying power of Medicare, which thereby reduces its impact on healthcare costs for everyone throughout the country, not just for Medicare beneficiaries.
Thank you. Thank the witnesses who brought us their personal stories, and thank both Ms. Davis and Ms. Stein
Thank you for your work.
Thank you.